Hello everyone, my name is Darlene Ikiraneza.
My name is Jimmy Nakenguruke.
My name is Blessing Akimara.
My name is Jindori Tangashaka, and we'll be talking about STEM dilemma, racial inequalities. And my topic is race disparity in healthcare, and I'll be talking about how environmentalism and marginalism connects to healthcare. And through economic powers, social politics, political influences, they all differ by place, race, and income. But through historical disinvestments, discriminatory practices, policies over time, structural racism, and adequate access to healthcare resources, they all lead to poor healthcare and health statuses. And for some marginalized communities, it's impossible to avoid living in these areas. And by looking back in time, you can see that slavery is a precursor to more recent discriminatory policies and social, political, and economic inequalities. And there's a simple solution to this. In conclusion, racial differences in medical treatment should be viewed in the context of racial inequalities and social institutions. Systematic discrimination is not the result of a few bad apples, but is frequently aided by institutional policies and unconscious bias based on negative stereotypes. To effectively address inequities in care quality, stronger data systems, more regulatory vigilance, and new programs to correctly train medical professionals and attract more providers from disadvantaged minority backgrounds are required. And national emphasis should be made on identifying and implementing effective methods to decrease racial disparities in health status and medical care.
We're going to be discussing about environmental racism. Environmental racism is the placement of low-income or minority communities in proximity of environmental hazardous or degraded environments such as toxic waste, pollution, and urban decay. Environmental racism is caused by a number of factors, including intentional neglect, the alleged need for a replicant of pollutants in urban areas, and the people of colors of institutional power and low land values. It is a well-known fact that polluting industries, particularly hazardous waste facilities, and lax regulation of these industries disproportionately affect communities of color and low-income communities.
Alright, so one known example of environmental racism is in 2014, to save money, the city of Flint, Michigan changed its water source to the Flint River, but failed to treat the reservoir, which exposed the city's 100,000 majority black inhabitants to dangerous levels of lead. And then an example of environmental racism in the main area is Lewiston and Auburn has the highest lead exposure in the state. Through lab research in Bio 195, lead affects the neurotransmission in the brain that then causes kids to encounter after effects such as lack of focus, slowed growth, slowed development, brain damage, inefficient learning habits, and speech problems. And the issue is that those unsafe neighborhoods are then put at affordable prices, which then puts minorities at a higher vulnerability.
As for solutions, they need to begin putting resources such as medical institutions in these low-income areas.
And they have to start informing these minority families on the risks of living in these unsafe areas before they start raising families there. Also, they need to get rid of these areas that are extremely unsafe and have a high probability of being fatal.
So, how is medical and environmental injustice modeled? Redlining is described as the discriminatory practice of denying services, typically financial, to residents of certain areas based on their race or ethnicities. The physical arrangement of cities and urban neighborhoods makes it hard to access healthy, safe, and fair community establishments. Medical services are restricted in these marginalized communities. Historically, there have been disproportionately more cheap fast food restaurants than healthy grocery stores in marginalized neighborhoods. This is in contrast to white neighborhoods where there are more healthy, cheap food options. Factories, oil sites, and pollutants near POC neighborhoods create bad food, bad air, and push marginalized people into the medical system with bad health care. So how does this relate to Lewiston, Auburn? And redlining in Lewiston, Auburn is shown in the concentration of hospitals, dentistries, and business establishments near more high-end, higher mortgage neighborhoods. With medical centers near higher mortgage, usually white neighborhoods, we see a separation between Somali immigrant residential neighborhoods and whiter neighborhoods. In the city plan of Lewiston, Putting money into low-income communities supports marginalized communities with traditionally redlined history. Bates could start by buying houses in safe neighborhoods and selling them to residents who owned less than the median income over the past 5 years.